Hello, everyone. It's Patrick, your pharmacist, your healthcare advocate here at Blue Zone Healthcare Advocates in Tampa, Florida. www.tampahealthadvocate.com. Now, I'm not just limited to the Tampa Bay area. Hit me up. Let me know what's going on anywhere in the country, and I can definitely help. I'm licensed here in the state of Florida as a pharmacist, but I can healthcare advocate for you anywhere. What I wanted to do today is advocate for my profession. I'm a pharmacist by trade, and we are one of the healthcare professionals that I believe, and a lot of my colleagues believe, go unrecognized in the world of healthcare. Our efforts sometimes kind of go to the wayside, even though we're very important. Think of pharmacists as the people that are making everything tick behind the scenes, making sure that you're safe with your medications and things like that. So let's explore a little bit more about why pharmacists are really the true unsung heroes of the healthcare system. So, first and foremost, we're medication experts. We know all about your drugs. We know over the counters, supplements, the prescription medications, biologics, injectables, all that stuff. That's a pharmacist wheelhouse. And so we possess an in depth knowledge about various drugs, including their side effects, interactions, and proper administration. Perfect example, to give you some free tip here. Generally, statins work better when you take them at night. Now, some people just get handed a statin. That's for a cholesterol medication. If you're taking it during the day, it's not really helping you as much as it could because the enzymes that create cholesterol really kind of get turned on at night. And so the statins help inhibit those so that you're not producing as much cholesterol. So statins work better at night. And so a lot of the time, pharmacists know that. That's very intimate knowledge of that specific medication. There's many more examples, but I got to keep it moving for you guys. Our expertise in medications as pharmacists allow us to advocate for patients by ensuring they receive the most appropriate medications tailored to their individual needs at the, I'm going to say this twice, lowest effective dose. One more time. Tailored to your needs, the appropriate medications at the lowest effective dose to meet those health conditions. So generally, a pharmacist is one of your most accessible healthcare providers. So you could walk up to CVS and you can ask questions. Walgreens, you can go ask questions. Like they're a little bit busy and they might kind of get annoyed with you. So I'm here for you, right? I'm very accessible. You can give me a call on my phone. You can send me an email through my website. But I'm here. I'm here all the time. That information comes to my phone. I'm very accessible to be able to help people within the healthcare system. So pharmacists are also often one of the most accessible healthcare providers for patients. Whether it's at a community pharmacy, a hospital, a clinic, pharmacists are readily available to answer questions and provide guidance, especially on medications. Our accessibility enables us to advocate for patients by offering medication counseling, addressing concerns, and promoting medication adherence. These are all really important. They're going to make your medications work better for you. So you're kind of going to get more bang for your buck if you're listening to your local pharmacist or your healthcare advocate pharmacist here. Kind of like on our last video, pharmacists are able to provide top-notch patient education and empowerment. And this is really what it all, being an advocate, being a pharmacist, all these things comes back to. Pharmacists play a crucial role in educating patients about their medications. We explain how to take medications correctly, discuss potential side effects, and highlight the importance of taking your medications on time, daily, when you're supposed to take it. It's just so important. It makes your medications work better for you. It's like if you went and bought a really nice car, like a Ferrari or something, but you put crappy gas in it, right? The car isn't going to run like it should. That car wasn't made to run on crappy gas. So you're putting all this money into your medications. Why not use them to the best of your ability to help you get better? So another key component, and this is one of our top tier services. I mean, you get this no matter what. If you have kids, you're getting this service, medication management and optimization. This is what I do. This is what I've done. And this is like my key service. I love doing this stuff. So as a pharmacist, I'm a champion of medication management and optimization. We'll review your medication regimens, identify potential interactions, duplications in therapy, which is key. This is something that one of the reasons I actually went into pharmacy is because my grandfather was prescribed 2 different beta blockers when he was diagnosed with congestive heart failure. He had a PCP prescribe one beta blocker and he had his cardiologist prescribe another. He took them both and we had a really nasty interaction. Okay. And at that point, I was studying chemistry and working in pathology, and I knew that I had to go into pharmacy because I wanted to help stop these dual duplicate prescribed medications, among other things. So also we perform medication therapy management services. So we're able to collaborate with our patients and healthcare providers to optimize medication therapy, ensuring the efficacy and minimizing the risk. So this even includes deprescribing, finding a medication that's not working for you anymore, finding a medication that you've kind of outgrown that you don't need. There's different reasons why you might need a certain medication, especially another, duplicate therapy or something like that. We can get those medications off your list. That means you're not paying for them anymore. That means you're not taking them, and we're reducing your risk of additional side effects. So pharmacists advocate for health equity. What does that mean? Well, we recognize the importance of addressing disparities in healthcare access and outcomes. I've worked in underserved communities, and it is really difficult because a lot of those populations aren't able to have access to a healthcare practitioner that can see them or that they can afford. So providing essential healthcare services, like I can take your blood pressure, I can help you take your blood sugar. I can do those things for you so that you're not stressed out about where do I find the resources for this. So promoting health literacy and advocating for policies that improve access to medications and pharmacy services is right in our wheelhouse. So to close out this short video, your pharmacist, me, here at Blue Zone Healthcare Advocates is your best shot at a healthcare advocate. There's some great ones out there, but having a pharmacist like me is really a top-notch service. I mean, this is like the pinnacle of healthcare advocacy service. This is going to get you the medications and the treatments that you need. We are indispensable as healthcare providers and advocates within the healthcare system. From our expertise in medications to the dedication to patient education and empowerment, pharmacists play a vital role in promoting patient safety, optimizing medication therapy, and advocating for health equity. Let's give a big shout out to all of our pharmacists out there. You're the unsung heroes of the healthcare system. With that being said, like, subscribe, and share this information with someone who might need it or someone who might just want to know more about the healthcare system. Patrick, your pharmacist, signing off.